Health.
Ministry of Health stands ready to respond to the impending storm or hurricane, whichever one it is. I will allow our disaster team comprising Dr. Joseph, as well as the heads of the two hospitals, the CEOs, to begin the presentation. Thank you.
Good morning, all. I acknowledge the head table. At this time, as indicated, the Ministry of Health, Wellness and Elderly Affairs stands ready to respond to whether we have a storm or a hurricane. Thanks. Thank you. And we looked at the various facilities within the primary care setting and the hospital. I will give you a summary of the primary care and allow the heads of the two hospitals to give you a summary of their level of preparedness. We have updated our national plans as well as at the community levels. We have in particularly looked at ensuring we have continued delivery of services within primary care. And as such, the contingency plan was put in place to ensure that the Grosley Polyclinic and the Dennery Hospital that operates from 8 until midnight will be operational for 24 hours starting today. Now that we will have some closure of the smaller facilities, which will be in line with closure of business places and the public sector. Mechanism was put in place to ensure that the persons closer to these facilities are going to be the one to deliver the services, noting that some of these facilities can be cut off from the rest of the islands and to ensure that we can continue delivering. We have looked at our general supplies, first for medical supplies and pharmaceutical, and our central procurement is already activated and dispensing medication to key health facilities, as well as ensuring patients have an adequate supply of medication to weather the storm beyond 72 hours. We have looked at the food supply to ensure that the wellness centers, as well as the staff at those facilities, will have enough food to last should we be impacted. The fuel for these facilities, the generators, they were continuously serviced, and they have been, most of them, complete their refueling process with the entrepot and ancillary fueling to be completed today. We have looked at our water supplies, and the facilities they do have adequate water supply to ensure that these key health facilities and even the other primary care facilities have adequate supply of water. And of course, we do have a contingency plan with WASCO to ensure that we can be resupplied. And of course, the Environmental Health Division would have put mechanism in place to ensure that if there is any interruption of water, they have some level of treatment to allow for the utilization of such. As indicated, we have made accommodation for the staff, and structurally, we have looked at the facilities in terms of cutting of trees, clearing of drains. Those have been more or less complete, and their communication at the various health facilities, in particular GIPC Soufrière and Soufrière Hospital, along with Dennery, where they have the two-way communication that will allow them to communicate with NEMO. As indicated, we looked at our human resource. I want to point out how much we have been working in collaboration with the rest of the team, as there has been the activation of the plans for the homeless, where they will be and would have been taken into the sports complex, and the Ministry of Health would have activated its team to be responsive physicians and nurses, and they should be at the facility as we speak, as we've had discussion this morning. To note, PAHO committed to supporting the Ministry of Health in the event. We have been in dialogue, and they are well aligned to provide some support. And one thing I would like to note, I do acknowledge the presentation by infrastructure, but we have a facility which is the Soufrière Hospital, and we do note at that river behind the hospital what can happen if we do not have the adequate clearance. So this is something that we should look into. So at this point, just to know that the rest of the departments within the Ministry of Health, that is environmental, nutrition, epidemiology, and all the other departments stand ready to provide their role should we have a storm. And at this time, I will hand over to the Millennium Heights Medical Complex to provide us with a summary of their level of preparedness, contributing to the overall Ministry of Health and Wellness preparedness. Thank you. Over to you, Dr. James.
Doug, before you go,
Okay, thank you.
You spoke about the generators. That's extremely important.
Yes. We do know that there was smarting of several of our wellness facilities, about 14 of them, and these were provided with generators, and we have ensured that these generators are functional and fuel, not only for the main facilities such as Dennery, Grosley, and Sufre, but the smaller facilities that have been smarted. Those generators are up and running. Actually, while we do note that there are 3 key facilities that will provide support for 24 hours to support the hospitals, there are some smaller facilities that we earmark depending on the level of impact that we can utilize to provide support.
Don't forget the one and Chipo.
Yes, yes. As mentioned earlier, entry
You said it wasn't. You said it didn't fill it yet.
Pardon me?
You said the one that was not filled as yet.
No. We have started even before the first Nemac meeting to ensure that our facilities, the generators and everything were up to speed. And as such, the process continues. And this morning, we just have 2 more to be completed. And by lunch, by this afternoon, that will be done. So all of them are being looked into, but the process, those are the last 2 to be completed this morning. Okay. Thank you.
Thank you, Dr. Joseph. Protocol established. Pleasant good morning. I am Dexter James, CEO of the Millennium Heights Medical Complex. Over the last 48 hours, we've activated our hurricane plan, and our disaster management team has been meeting at least twice a day to make sure that we're in a state of preparedness to address the perhaps unlikely event that this hurricane will hit us. We assure the public that we, the OKU, and the entire complex is in a state of readiness and preparedness for any eventuality, whether it be a hurricane or a tropical storm. In terms of our infrastructure, our generators, which are normally checked on a daily basis, are fueled and can support the hospital for 12 continuous days. We do have water supply that can run the hospital for at least 7 to 8 days, which is above the standard set by PAHO WHO of 3 to 4 days. In terms of food supplies, we've been taking steps to ramp up our food supplies over the last 2 months to at least 25% of our normal usage, so we believe we're pretty okay where food supply is concerned. We've updated our call-out listing. As of today, our backup team will be on campus to make sure that we have staff to continue operations in the event of a total shutdown. We have also started to discharge patients as of yesterday. The occupancy level now at the hospital is about 75%, both at OKU and the National Mental Wellness Facility. We continue to discharge patients as of today. There are 21 patients in A&E now that we are seeking to move on to the wards. Patients on life-threatening therapies, dialysis, cancer treatments, they have been called in to receive treatments, shorter treatments, so that they could tie them over during this period of wait. In terms of the respiratory hospital, the secondary care facility, to be more exact, we had a meeting yesterday with the disaster planning committee on that site. As you know, the facility has now been repurposed as a Castries multipurpose medical facility. We only have 10 patients in a 12-bedded unit at the chest wing. 3 of those patients to be discharged today. We're waiting for the relatives to collect them. They will be on oxygen concentrators. And so we believe that facility is in a good state. Yesterday when we met, there's enough water, food supply, backup generators are working, The generator itself can run for about 7 days continuously, so we're pretty happy about that situation. We'll continue to provide support from OKU, from the complex to the facility as we begin the transition process. So all in all, we give the country and the cabinet the assurance that the Mineral Heights Medical Complex, both facilities, are in a good state of readiness to withstand any eventuality as we speak.
Good morning. I'd just like to acknowledge the head table, the Prime Minister and the Ministers of Cabinet. My name is Sherwin James, Medical Doctor, Emergency Department, Head of the Disaster Committee for St. Jude Hospital. So I just wanted to provide an update on where we are. As of yesterday, yesterday we had a lot of the loose chairs and some of the loose metal that's coming from the roof cleared up on the east wing. About half of the west wing was done, and that should be completed this morning or at least later today. We are trying to implement temporary measures to seal the internal seismic joints of the stadium, because normally we would get water coming through those joints, especially when it's heavy rainfall. So that's being done. The windows and the doors, because there are lots of glass windows and doors, so that has been secured using plywood. So we bought them up during a hurricane. We also have sandbags which were filled and ready to be placed in front of those doors, which water would tend to come through if there's lots of wind. We have a 200,000 gallon cistern underneath the stadium, which is filled. We also have about 21,000 gallon water tanks around the stadium as well. All of those are filled. Our pumps have been checked, so all of these are in working order. Our generators have been serviced. They are constantly tested, but we've done extra testing throughout the last week. Everything is functional. We do have a supply of fuel which should last the hospital about 7 days if we had to run it continuously. The drains around the compound have been cleaned. We have done some tree trimming. All hospital vehicles, including our ambulance, are fueled and ready to be deployed if the need arises. We do have our maintenance staff who will remain on compound to assist if during the hurricane there's anything that needs urgent attention, and obviously for after the hurricane. In terms of our supplies, inventory has at least, more than a 2-week supply for cafeterias. Our dietary department is well stocked. We can sustain ourselves for 2 weeks at least and more. Pharmacy has procured all necessary medications and IV fluids that can last again about 2 weeks. In terms of our medical staff, so our plan for the hospital is that we have 2 teams in place. We call them Team A, Team B. So our Team A will comprise of persons who live closer to the stadium, and they will be the ones who would be expected to remain on compound during the hurricane. So persons who live further are allowed to go home as of midday, 1 o'clock. And all on-call staff and emergency staff will remain on compound. Same would apply to the nursing team. They have 2 teams in place, Team A and Team B. Team A would stay. Once the all clear is given, Team B will come in and relieve Team A so that care can be continued to our inpatients and outpatients. We are, just like Millennium Heights, discharging patients who are stable enough to go home, and that their discharge will not compromise their health care. So that is being done currently from yesterday into this morning, which obviously will reduce on, 1, bed occupancy. It reduces on the supplies that would be needed to house and treat everyone. So that way we make provisions for a possible disaster, because we are not sure if we'll have an influx of patients after the hurricane, because we really don't know what can happen, so we need to prepare. Let me see. All Specialty clinics have been suspended as of today. Elective surgeries have been suspended. All other non-emergent services that the hospital provides, for example, physiotherapy, have been suspended until the all clear is given. All emergency services at St. Jude Hospital will continue. So emergency department will be fully equipped and functional. We will be prepared if we need to do any emergency surgeries, emergency dialysis. So all emergency services will still be available, imaging and labs. Okay. Our biomed team and our IT team are now securing the equipment as we speak. So they're doing all equipment, unless it's not an absolute emergency, will be shut off. During emergencies, can be used. But we will be doing a lot of covering of our equipment just because of the possibility of water coming in. Other than that, so that's it for St. Jude's.